posted by the town clerk, at the town clerk's office on February 7th at 3:50 PM. So the 48 hours has gone by. I'd like to have somebody make a motion for approval of the previous meetings, which you've received, minutes of the previous meetings, which you have received.
So move.
Second.
Second.
And before the vote, Mr. Chairman, if I can just say that we approve, there were a couple of grammatical errors, but that do not change the essence of the statements made. So if we can approve it with those changes, and I can forward that to Alicia after the meeting, if that's okay.
That sounds good.
We don't have to go through all of them.
Okay. All right, so we'll take a roll call vote. I vote yes. Dee?
Yes.
Sheila?
Yes.
Okay, so it passes. Who wants to start the introductions? Why don't we start with the least known person, the new guy.
There you go.
Point taken. Hi, everyone. My name is Frank Giacalone. I am the new Director of Public Health for the town of Danvers. I did start on the 24th, so this is going on my third week. I do live in Beverly, so I'm very close by. And prior to coming here, I was Director of Public Health for the city of Newburyport for the past 6 years. And prior to that, I was in Saugus as director, started as inspector there, and also did some work in Beverly. And I also did some contracted work here in Danvers, believe it or not, a few years back, doing food inspections. I am a registered sanitarian, so I did get my top credential here to hold this position. And I have a Bachelor of Science out of UMass Amherst. And I'm looking forward to ending my career here in Danvers with many more years to go. So thank you.
Thank you.
All right,
Thank you, Frank.
Would you like to go next, Dee?
Oh, sure. I'm Jutoshen Joko. I go by D for short. I live here in town. I always like to introduce myself as a father first. I hope my kids appreciate that. And a husband to my wife, Jocelyn, of over 22 years. I'm a pharmacist by trade, and have been on the Board of Health, I don't know, maybe 4 years now in town. I started my public health journey back in the early 2000 when I worked at the Sloan Epidemiology Center at Boston University. And so I'm a former school teacher, or say school teacher at Lexington High School. So after my master's in science, I did a little bit of research at Mass General Hospital in the Department of Neurosurgery, then moved to be a teacher for a few years after my master's in education, then went back to pharmacy school and earned my doctorate in pharmacy. Worked a little bit at the Sloan Epidemiology Center and have been a clinical pharmacist for over a decade now in retail and hospital setting, as well as in the industry. I do a lot of volunteer in town. I love my town. I serve on the advisory board for Recovery Center for America. I also serve on the QPAC committee, which is Quality Practice Affair Committee for MGBS, which is Mass General Brigham and Women and Salem Hospital, as well as on the Community Benefit Advisory Committee for Gilbert and Beverly Hospital. So I'm a town meeting member here in town, Precinct 8, which I will be PSA here. I'll be running again, but now in Precinct 6. So, and also serve as the chair of the town Human Rights and Inclusion Committee.
And what do you do when you spare time?
I saw him at the spelling bee last night.
Exactly. I will not miss any of my kids' events and activities. That's for sure.
Sheila, would you like to go next?
Sure. I'm Sheila Laffey. I have been a resident here in Danvers for just over 20 years. I live here with my son and my husband, my dog too. I actually joined the board, I realized, February of 2020. So lucky me, perfect timing. And I do not have as extensive a volunteer history in town as Dee does. This is my first time volunteering here in town, but I do love the town and wanted to step up and do some volunteering. I am currently the program director for a high-risk intervention team at Beverly and Addison Gilbert Hospital. And that consists of a few different programs. One is a transition team that helps at-risk population that are discharged from one of those hospitals to get connected with services in the community. So it ends up being a lot of folks who maybe don't have a lot of natural supports out in the community and need help getting access to maybe the senior center, maybe to recovery services, to medications. My team follows up and makes sure that folks have what they need to remain healthy and happy in the community and not have to come to the hospital over and over again. The other part of our team is part of a grant program that's called the Healing Communities, and that is out of Gloucester and is focused on opioid addiction. So it provides wraparound services for the community of Gloucester for opioid addiction. There's various community members on that coalition, and we gather to do what we can to ensure that those with opioid use disorder are getting the services that they need. And then it's also a Moms Do Care program, and that is a program that is designed for women who are pregnant or parenting children up to the age of 3 who have current substance use or a previous history of substance use, including marijuana and even tobacco. And that is, again, a team that provides wraparound services to these moms to be able to parent and potentially go on a recovery journey. We'll support them along their way, get involved in with DCF cases if needed, if DCF is involved, and just provide whatever kind of support services we can for those moms. Prior to that, I worked for a consulting and training company that did services for the healthcare industry. A lot of it was regulatory, but we did all kinds of training, whether it's video, in-person seminars, conferences, all that, and any kind of consulting for hospitals as well. And then prior to that, because I'm old, so I've done a lot of different things, I was at several different home health agencies. So I was at home health agencies in this area, as well as I spent some time out in California and worked at a home health agency out there that also had pharmacy services and hospice services. So I've kind of been in the healthcare industry since I graduated with a healthcare degree in healthcare management from the University of New Hampshire. And I think that's probably enough about me right now.
All
Thanks.
right, Judith, you're up. You're up.
Hi, everyone. Thank you. Judith Ryan, she, her, hers. I am the public health nurse here in Danvers. I've been public health for, actually, it'll be 7 years coming up in a couple of months. I've been a registered nurse for many, many years. And I should have started like Dee did. I am a parent. I am a resident here in Danvers. Been here since 1994, I think it is. Prior to public health, I was in the hospital setting. I was in long-term care setting, and loving being a public health nurse.
Okay, I guess it's my turn. I'm Tom McLaughlin. I'm in addition to working on the Board of Health for, I think it's 12 or 13 years now, I'm also the school physician in Danvers, which I've been since the early 1980s. I graduated from Danvers High back in the days when dinosaurs roamed the earth. And we moved to Danvers when I was 4 years old, so that doesn't qualify me as a townie, unfortunately, because I wasn't born here. But I've been here for quite a while. I graduated from Tufts undergraduate and Tufts Medical School. I'm board certified in pediatrics. I've been practicing in the Danvers area for 43 years now. And before that, I worked out in Springfield. I had a private practice in Chicopee for 4 years before that. I have 4 adult children, 8 grandchildren, 3 of whom are in the Danvers school system. Well, 2 of them are in the Danvers school system, and the third one will be joining next fall. So I have an interest in the educational system in Danvers. So that's me. So we're going to vary a little bit from the agenda in that we're going to go to Judith's COVID update and a little discussion about that afterwards. And then after we finish our discussion, we'll open it to public comment. So Judith, you're on.
All right, thank you very much. So our numbers this week, do this. The total confirmed cases this week, so lab confirmed, are 74 total. I broke it down to 18 and over are 53 cases. Under 18 are 21 cases. And just for a point of reference, 3 weeks ago, so back on January 27th, we were at 172 total cases. Last week, we went down to 63 cases. This is for 18 and over, by the way. Down to 63 cases last week, and then we are at, again, 53 for this week. On January 27th, for the under 18 age group, we were at 58. We went down to 14 last week and up to 21 this week. And again, these are confirmed, lab confirmed. I did, so you heard last week how the school is changing from they're going to be doing the home testing versus the test and stay. So what I did this week was, and the schools started really keeping track of home tests this week. So I actually asked for a little, the breakdown of the home tests that they got. There were a total of 23 positive home tests this week. So those are in addition to my total is 74, because that 74 is the only, our only lab confirmed. And do you want me to give you the numbers in each of the schools, or does it matter? No? Okay. All right. So we have 23 total in the 7 schools that we have here in town. And those are just the public schools. So that's not Essex Tech. That's not counting the private schools or anything. Our positivity rate for the last week is down to 0.09%. It was 12% last week. And 16, it's been last 3 weeks ago, 4 weeks ago, we were 17 and 16%. So the positivity rate did drop. And I just looked at a couple of our surrounding communities. Peabody is actually, Salem is lowest at 0.06%. Peabody is 0.0%. Excuse me, 0.07%, and Beverly is 0.08%, and then we are the 0.09%. And again, that positivity rate is for confirmed only, so it does not include any of the home tests. Vaccination rates, I won't get into all the different categories, but I will tell you that all residents, so again, from 5 years old to 110, we have 77% total.
Wow, that's an improvement, isn't it?
Very
It
slight.
is.
Yep.
Okay.
It's a small improvement.
Yep.
Yes.
And then we have, I can go down to the 5 to 11-year-olds, and that's 43% this week. 12 to 15-year-olds are I'm just doing the math in my head, 63%. And then the 16 to 20-year-olds, and actually 5 to 11 and the 12 to 15-year-olds, they did go up slightly from last week. The 16 to 22-year-olds are at 76%, and that was no change. So the highest percentages actually are 51 to 65-year-olds. They're at 84%. And I think that's it for my numbers.
And I note that probably by our next regularly scheduled meeting, we're going to be starting with the 6-month to 4-year-old group vaccinating. It looks as though the CDC is going to approve the vaccine for that. We don't know the exact schedule and dosage yet, but they're likely to approve that. They think that may require a third dose, particularly in the 2 to 4-year-olds. So
Yeah, APIC was going to be meeting, I think, today or tomorrow, I think, for that, for those little ones. And actually just a couple of other things. They are talking about increasing, especially for the severely immunocompromised. They're talking about a fourth dose for them, and anybody that had the J&J. Not only have they recommended that they get a booster, now they're just saying that they should actually get a third dose
yeah.
of messenger RNA.
Mm.
And then the only other thing is just this week, they came out with the schools. The mask mandate will be lifted on February 28th. They kind of had that date in place, but they just made the official announcement the other day that the mask mandate will be lifted in schools. The federal mandate is still going to be in place, which means that on school and other transportation, masks are going to be required. So what that means is on school buses, going to field trips, going to games, band, anything like that, they will be required to wear masks.
Yeah, and just a quick point of clarification, Judy, just so I make sure I understand. My understanding was that the SC mask mandate was going to expire on the 28th, and they decided not to renew. But they're leaving it up to the different city and town to decide if they want to continue or not. I think that's the caveat, because I think as of this afternoon, Boston just said they were going to go a little longer. So I just want to make it clear that it's not that it's lifted,
Right.
it's that, DESI is not going to renew their mandate, but cities and town have the option to then decide based on their specific community.
Correct. Yes. In EEC, early education, they are not, as of right now, they are not making any changes. So they're keeping as is. EEC did say that they may be making some changes next week, but as of right now, they still require masks and for anybody that's 5 and older, they recommend it for the 2 to 4-year-olds. And then under 2, obviously, they don't.
That's correct.
All right, so with that, all that encouraging news, we did talk last time that we would meet tonight to consider removing the mask mandate. And at least my feeling is that with this encouraging news, we can certainly consider it. There's a saying in medicine, you should never be the first one or the last one to do something new. So this would put us squarely in the middle of the pack, because there's already some communities around that have started lifting it, and there's others that are saying not yet. So we'd be right in the middle of the pack of that. And we also have the option always, if things really, really, really go south, of revisiting it. We don't have to feel like this is a permanent solution. There's all kinds of things that could happen that would make us reconsider that. But I mean, my feeling is maybe we should consider lifting the mandate. Does someone
I
want
I agree. I mean, I love the numbers. I wish it was zero, but I really love the trend. And this is something that, we've been struggling with for some time, which is, what number is the number? And unfortunately, it's hard to say. Is 74 the breaking number, or is it 100, or is it 73? But we've always tried to look at trends, and the trend and the trajectory that we're in and that we're on is really encouraging. From 467, 494, 428. I like to be visual as a former teacher. I don't know if Erin has my magic map there, but the trend is just amazing as to where we.
think we lost
You froze.
you. I think if it's helpful, I do have a short slideshow of data. If that's, I think Dee was teeing us up for a slight short slide.
I think it
Uh,
would be good to see it because it does, I agree with Dee. It will show a good trajectory. And I
Yeah.
think all the numbers are going down, not just, I think it's important that we look at everything, not just number of cases, but positivity rate, cases in conjunction with hospitalizations and what surrounding towns are doing. So just looking at county data, all of that data is going down sharply, which is very encouraging.
Here we go.
Dee, we lost you for a second, but I think we got the point that you wanted to see some numbers. So hopefully my screen has been shared. There's 6 slides here of data. These more or less jive with Judith's numbers. I'll talk a little bit about that in just a second. But this first slide is the weekly case count that Judith reports. This is pulled from a slightly different publication than the one that we post on the website. And really the difference here is that this is pulled from the system the practitioners are using on a day-to-day basis. The numbers we publish on the website lags in some cases by as much as 10 days so that some of that cleanup can occur. So the state publishes a cleaner set of data, again, 3 to 10 days later, and that's what we push on the website. But Judith's numbers are helpful to have because that's kind of an immediate snapshot in time of what we're seeing in the system. So as Judith already told you, good trends the last couple of weeks, definitely coming down. Obviously, home tests are not reported, except in this week, we did add the 23 that were verified through the school department. But again, good trends. So now jumping to the next slide, if it works, there we go. So the 2-week case count, again, this is from the state published data. This is on our website. The link to the data set is also on our website. So this links you right to what the state is publishing. This has a lag of about 10 days. So on Thursday, they publish the average from the last 2 weeks. So the end date for this report is 2/5. So the number 278 is the average daily cases between 130 and 2/5, roughly speaking. It kind of smooths over some of the impurities in the raw data set, and I think that's why the state publishes it. But again, it gives you a sense that we saw a peak around the week of 1/8, and then things started to fall. The next slide is the positivity rate, and you'll note that, again, this kind of lags some of those other indicators. But again, we're seeing a good drop back. Again, this is about 7 days to 10 days old. So again, this is still showing a positivity rate around 8, which is about what it was a month ago or the week before Christmas when we were also at 8%. The next one is COVID hospitalizations. This is picked out specifically for Beverly Hospital and Salem. The lines above are general hospitalizations, including those in ICU, hospitalized with primarily COVID. So there are patients that go to the hospital with a heart ailment and come down with COVID. That's not what this is reporting. This is reporting people that were admitted due to distress related to COVID. And then these lines down here are the ICU beds being occupied by COVID patients. And pleased to report that on February 9th, North Shore Medical Center reported 0 ICU beds. So again, we're in a good spot on this trend. And then the state also publishes, they don't give us the data by hospital, they give it to us by region. So in the Northeast Massachusetts quadrant of the state, over the last 60 days, what this chart shows you is ICU bed availability on a daily basis. So this goes back to the beginning of December through February 9th. And you've heard probably in the news, people are talking about 95% availability has been used and thrown out there by some. So what you'll see here is that we are trending in the right direction the last couple of weeks. And currently it's around 15% availability. So again, a positive trend on that metric. Finally, and Judith talked about this, here's what a version of what we publish on our website regarding vaccination status by age group. And then just highlighting the two columns all the way to the right. They're really reporting the same number, but have a different denominator. The column 5+ is those Danvers residents over the age of 5 that are eligible for vaccine. And at that point, we're at 81% of those folks are vaccinated. 46% of those people, sorry, I know it's like percentages upon percentages, but so of those 81%, almost half of those people are also boosted. The change, and this is where I think in prior meetings we've had some confusion because we're posting one number and other folks will say, no, we're only in the 70s. When you add in the 0 to 4 age group, that percentages obviously drop because you're adding a couple thousand of individuals to the denominator. And when you do the total population of Danvers, we're at 77% are fully vaccinated, 8% are in process, and 11% have not. Of those who have received, or of those who are fully vaccinated, 44% of those have received a booster shot. So those are really to kind of put a graphic to Judith's numbers. And again, those we publish case counts, total case counts, and the vaccination status on our website. I try to do it Thursday afternoons, but that's been difficult of late, but it's usually up by noon on Friday. And again, I've got all the homework done. I just have to post it. I'll do that first thing in the morning.
So we actually can be looking at 90% vaccination rate if when those people that are not boosted yet follow through.
In theory, again, I will say that
Yeah.
some people don't follow through and don't go back for the second shot. But in theory, one would assume that the 8% of people that are in the queue will follow the course.
Oh, this is really great news.
Yes.
Yeah,
So-
I mean, we had said, Mr. Chairman, from the beginning, we didn't want to keep the mandate on any hour later than we had to. I'm really excited with these numbers and really pleased with the totality of what is being presented tonight and the trend that we're following. So I will say that I will be in favor of I'll be making a motion that we rescind the mask mandate immediately.
I second that.
All right, so I vote in favor. B,
That would be a big I.
Sheila?
Absolutely, yes.
I don't have a gavel here, but I'll knock on the table. So we are no longer under mandate.
Excellent.
And just as a matter of the communication, I think Aaron and Frank, you probably send that out to the different avenues that the town have to communicate with residents and businesses.
Yeah, yes, I'll talk to Jen, who's in, I guess she's the communications person I'll need to discuss. But yes, we'll get a press release out for those that don't have access to a computer, and we'll hit the newspaper, the local channel, if they have some type of a alert system. But we'll get it out at different venues, and obviously it'll be on our website as well.
I would also like to suggest that we start holding our meetings in person. I don't remember exactly how we got sort of off track. We were doing them for a while and then we suddenly stopped. I guess it was during the initial spike, but I don't see any reason why we can't meet in person now. I will say that, that when people come to the meetings, that they have to be courteous of their neighbors and try to keep as distant as possible. That makes a lot of sense during infectious disease season generally, not just for COVID, but You just don't need to be giving anything you have to your people sitting next door to you. So if you get a chance to sit a seat or two away from the next person, please do so at the meetings. So I guess we're ready for public comment. I think we should probably, limit it to 3 minutes, at least to the first go around. We'll see how many people we have. I don't want people doubling up until everybody who has, wants to make a comment has a chance to. So we'll go through everybody first, and then after that, we can take second ones if somebody wants to.
Okay, and then just, I'll start enabling. I'm just gonna go in the order of the hands. I apologize. I know somebody raised a hand and then put their hand down and then they come back up and they go to the end of the line. I apologize, but we'll just go down the list. And then I will give you a warning around 2 minutes that you're approaching your 3-minute, mark. So first up is Ms. Keneally. I will enable the microphone. And if you can unmute yourself, the floor is yours for 3 minutes. Ms. Keneally, hoping you're well. Let's we'll come back to you. You won't lose your place in line, but let's move on to the next one just in case. Mr. Trainer, can you unmute and give that a try?
Yeah, can you hear me?
Gotcha. Floor is yours, 3 minutes.
Thank you. I won't take that long. I just want to point out one little flaw with Judith's numbers. When you count the in-school tests into that mix, a lot of those people that do the in-school tests, especially with February vacation coming up, also get a PCR test right afterwards because they'll be traveling. So I know at least in 2 of those cases, they were counted twice because they tested positive at the school and then they went to get a PCR test after that. So I just do want to point that out when you add those up that way. You understand what I'm saying?
I think she's nodding. Yes, we understand. Yep. I think we were
All
just.
right. I just wanted to point that out that some people were counted twice in that number.
These are only going to be really sort of fuzzy numbers anyway, because there's all kinds of overlap and people get 3 tests done and it may count as 3 separate tests and yet it's not 3 separate people. So.
Okay. That was really my only comment. Okay. Thank you, guys.
Thank you. All right. Let me try Ms. Keneally again. Maybe 3 minutes helped. Ms. Keneally, can you try to unmute?
Can you hear me?
Gotcha.
Thank
Great.
you.
Sorry about that.
No,
Floor is yours.
I went out and came back in.
Oh, perfect. Yeah,
technology is wonderful. I'm glad to hear you're going to move back to in-person meetings because that will solve a lot of these technical issues. So first of all, I'm glad that you all voted to rescind the indoor mask mandate that was put into place in December. I wanted to ask, what about the indoor mask mandate for municipal buildings and what your plan is with that? I do know that Linfield voted tonight and rescinded their indoor mask mandate for municipal buildings, and considering all of the positive news that just was shared and where we are today, it sounds like that should also be rescinded, but I didn't hear that come up. So I was just curious what your plan is there.
I don't think that was ever separate. I think that was part of the same mandate. I don't think we had separate mandates for municipal buildings, so that counts for everything.
Okay, there had been one in place since August that was only for municipal buildings. I didn't know that you put them together. So if I'm hearing you correctly, what you're saying is the mask mandate for all of Danvers, whether it's a public building or a municipal building, is now rescinded as of today.
Correct.
Thank you.
Can I just clarify, Mr. Chairman? Again, this does not include the schools. Remember, the schools are still under the DESE mask mandate until the 28th.
Got it. But like the library, for example, is no mask mandate now.
There's no mandate, but I believe the town manager, sorry, this is Aaron. I believe the town manager still could keep that in place, but he's not required to.
So how will we know I guess my question is, what is the process?
again, I think that's a decision of the town manager, whether or not to have an individual requirement for entering town hall. We have talked about it at the staff level. No decision has been made, obviously, because we needed to see what happened tonight. And I'm sure, the town manager's office will take this into consideration, but I do know we've been talking about it, but we didn't know how tonight was gonna go, so no decision's been made, but I think it's fair to say there's no requirement that we have one, but I believe the town manager still has the discretion to impose one at public buildings. But we can clarify that, and we will obviously announce what that is to the community as soon as we have a decision.
I'm sorry if I misspoke. I assumed that it was the same mandate, so.
Well, it's the same mandate, but I think just like any private organization, right? You could go to corner grocer and they could require their patrons to wear masks. So I think it's like that, but we'll clarify that and obviously make sure the community is well aware of what the rules are going to be. Next up is Mark Smith. I will enable your microphone and now you should be able to unmute yourself and the floor is yours.
All right, thank you. Can you hear me?
Got you. Yep, we got you.
All right. Well, first I'd like to commend you all for handling tonight's meeting as best as I could expect. When I saw on the agenda the public comments were before the updates, I was a little concerned, but you quickly rectified that, so I will give you credit. I do appreciate the effort you all put into letting us know who you are and your backgrounds. And I noticed that there was a lot of information on working with people in the addiction and mental health field. So with that in mind, we're going to move on from masking to the next topic that you had, which was the vaccines. And I want everybody to understand that these vaccines are coming from pharmaceutical companies, the same pharmaceutical companies that are involved in the opioid epidemic. I'm talking about the drugs, heroin, methadone, tramadol, fentanyl, oxycodone, hydroxycodone, hydroxymorphine, oxymorphine, codeine, morphine. These are the pharmaceutical companies that have put this nation and the world through the opioid epidemic for the past 20 plus years when they started treating pain with opioids. That was supported by the universities, the medical institutions, the doctors. Prescriptions were written, and last year, 100,000 people died from opioid overdoses in 1 year, last year. Dr. McLaughlin, you mentioned how the Johnson & Johnson is now going to be potentially a third dose. The Pfizer and Moderna mRNA is going to be potentially a fourth dose. We're talking about people taking these medications potentially for life. And that is something we need to reflect upon. The scandal that we just came out of with the opioid epidemic, Johnson & Johnson, hold on.
Minute, Mr. Smith.
None of those companies made any opioids.
That's not true. Johnson & Johnson actually
All right,
owns
so Johnson
Janssen Pharmaceuticals is owned by Johnson & Johnson, and it was Peter Janssen who invented fentanyl, the most deadly synthetic opioid we have right now. Johnson & Johnson has paid billions of dollars in fines, and Moderna has no products on the market after 13 years in existence. Their first market approved with emergency use was this vaccine for COVID-19. It's their first product in 13 years. So we're creating a new epidemic of immune deficient people who need this injection, just like we did with the opioid epidemic. And as responsible people, you went through your credentials working with that population. I think you should consider before we open Pandora's box and create another 20-year epidemic. These vaccines are dangerous. They're not good for humans. They're toxic. They need to be considered as unsafe. All right, I appreciate you lifting the mask mandate tonight. Thank you. And I hope you look on to the next mission, which is keeping our community safe from these potentially dangerous injections.
Thank you, Mr. Smith.
Thank you.
Next in line is Ms. Skinner. I'm going to enable the microphone, and if you can unmute yourself. Can we hear you?
Can you hear me?
We got you. The floor is yours. 3 minutes.
Thank you. I'm going to go ahead and make more or less the statement I had planned to make, but thank you for rescinding the mandate, which I obviously didn't know until now. I'm just a little alarmed to hear you tying that to current numbers and already talking about how you could put it in place again at some point. So I want to go ahead and say what I had planned to say. Those of us arguing against mandates are being accused of having pandemic fatigue. We're accused of being unwilling to do small things to help our community or to protect our neighbors. No, the mandate should be lifted because it is not an effective means of mitigation. Experts in many fields spoke out about this early in the pandemic, including Fauci, who expressed early in 2020 publicly and in many private emails that masks would not be helpful. Then science became unfortunately politicized, and we lost the ability to have productive conversations locally or nationally about pandemic strategy. Last week, I heard members of this board claim that because cases in Danvers fell after they reinstituted a mask mandate, the mandate had been successful. This is not how scientific research is conducted. Correlation does not prove causation, and similarly, mechanistic studies conducted in controlled labs are simply not as useful as 2 years of real-world data. Early in this pandemic, people could try to cherry pick data and point to interventions as being causal, but today we can't do this responsibly. We need to look at the big picture. 2 years of data showing seasonally driven surges that peak and fall regardless of regional non-pharmaceutical interventions. Recently, cases in Japan, widely praised for their masking, have gone up 133,000%. Washington State, with a statewide mask mandate, currently has one of the highest case rates in the nation. New York and New Jersey, seasonally similar to each other, have cases rising and falling in sync, despite New York's mandates and New Jersey's lack of them. Even considering N95s, Berlin and Bavaria have mandated these, and their cases are no different than Germany at large. In 2020, the previous CDC director claimed that if we all wore masks for 6 or 8 weeks, we would bring the pandemic under control. That's a quote. Obviously, he was incorrect, but the more that
1 minute to go.
efforts have failed, the more we've moved the goalposts and continue to do the very things that have failed to make a difference. The science has not changed. The WHO released an extensive document in 2019 that stated there was no evidence face masks are effective in reducing transmission of influenza. This data has been there too long for us to continue doing what we're doing. We want to do what we can to ease the challenges of this pandemic. I can speak for all Danvers residents. We want to help. Let's divert our efforts towards things that do make a difference instead of clinging to political theatrics. Just wear a mask could be said if there were no downsides, but we know it isn't the case. We're in a mental health crisis.
Skinner, you're up against your 3 minutes.
You should not reinstate the mandate any more than you would mandate a rabbit's foot. The mandate should be lifted permanently because the benefits are not there and the drawbacks are severe. Thank you for your time.
Thank you. Mr. Betancourt is up next. Let me enable the microphone, and then if you can unmute yourself, the floor is yours. Do we have audio?
Yes, sir. Yeah, can you hear me?
Perfect. We got you.
Yeah.
Okay, floor is yours.
Rick Betancourt, town meeting member 5. I was, a couple things, a couple businesses that are downtown, their constituents of mine, and wanted me to attend to make sure that the way it went tonight went the way it went. And I'm very proud and happy that it did go that way. Primarily, I wanted to jump on and say, Dr. D, I am beyond proud of the way that you handled yourself in the last meeting, and how you saw that there was some issues with the manner in which that meeting was held, and you quickly corrected that. So I just want to say, as a town meeting member and as a member of as a citizen of the town of Danvers, I couldn't be more happy with the way that you had stepped up and said, listen, people need to make a comment. People have concerns and they should be heard. So to you, Dr. D, bravo. Thank you very much for being a voice. I think I have run a national nonprofit, a 501c6. I was a president, 8,000 members, $1 million, $2 million budget, run committees. I understand Robert rules. And I would simply say that I think the manner in which the last meeting was held, procedurally, there was some things that you guys could have done better. I think that the disclosure of non-public comment could have been done better. I think that so the way that meeting was set up could have been done better. We constituents in Danvers rely on this public forum to be able to voice concerns or praise or whatever it might be. And as a town meeting member, it's my job and my duty and my mandate to voice concerns when I see public committees not operating, I think, the way that they should have operated. So I just wanted to put that out there, and I'm happy to engage offline. My point here is not to criticize, but simply to highlight some opinions of mine. as far as, some of the commentary tonight, I think that focusing on home testing, I don't think is appropriate. It's got a 20% or greater fail rate. So to include those in our sort of numbers, continuously bringing them up, I don't think is appropriate. I understand the reason why they're there, but I've been the subject of a false positive. So I don't think it's something that we should be including in our numbers when we're trying to qualitatively identify positivity rates. So I don't think that should be there. My daughter has not received the vaccine. She's 17. She will not receive the vaccine. And just recently, we saw a study regarding young women and menstrual cycles to determine if there's something going on there. So I would simply
Got about 30 seconds.
ask that this committee not encourage the vaccination of individuals under the age of 18 that are not adults. Let that to the parents, let that to the families. Let us make that decision if it's in the best interest of who we are and our daughter or our sons. But with that being said, Dr. D, great job last week or 2 weeks ago for your meeting. Thank you very much, sir, for speaking out. And I appreciate and applaud the committee tonight for making the right decision based on the data that you have, and clearly the data that's across the United States. So on behalf of Precinct 5, thank you guys very much. I appreciate everything you've done, and good luck.
Thank you.
Thank you. Next up is Devin Freeman. I will enable the microphone. If you can unmute yourself, make sure we got audio.
Oh, hello?
Gotcha. You're good. The floor is yours.
All right, great.
Minutes.
So unlike people before me, I'm not going to simply sit here and thank the board for lifting this mandate, because we all well know that in the next 5 days or so there's going to be another variant out there, and they're simply going to put it back on. So I'd like, with that being said, I guess the one question I have is, why is vaccination rates being considered when questioning whether to lift or keep the mask mandate? As we all know, people vaccinated or not are getting COVID either way. So I'm really confused as to why that metric is being used in this decision.
I'll jump in for the board. I'm not sure that was. It was just a bit of data that the board has been following, but I didn't hear that tonight as a reason to drop the mandate. I thought I heard case numbers and positivity much more, but I'll obviously let the board answer that. But I also want to just suggest to folks that, I don't know that the public comment was designed to be a big back and forth, but that said, I'll leave that to the board, how they want to handle questions posed to the board.
Well, we just encourage vaccination. I don't think there's any medical reason not to. There's very few people that are ineligible for the vaccine. It is safe and effective. The overwhelming number of people who are hospitalized and who are in ICUs or are on ventilators are unvaccinated. That's the fact that just doesn't go away. So people can have private concerns about the vaccine, but it's only been around for a little over a year now, and we really can't know what the long-term effects are. But I do know what the long-term effects are likely to be with COVID, and it's much more serious. So we're not going to stop promoting it. We're not going to stop encouraging it. At least I'm not. And as Aaron said, we didn't use the vaccination rate as a metric to decide whether to remove it or not. We simply looked at it as an encouraging piece of information that more and more people were being vaccinated. That's all.
I guess I'm perhaps I misunderstood, but I just really don't think that metric has any place in this discussion. As people vaccinated, no matter how many times you go back for another shot, you're just getting COVID anyway and spreading it. So I just don't really think that metric has any
well,
place
we're
in
in
this
public
discussion.
health. This is part of public health. Vaccines are one of the most important public health tools we have, and we'd be not doing our job if we were in any way discouraging people from getting vaccinated.
That's all I have. Thank you.
Thank you. Up next, we have Mr. Matt Farley. Mr. Farley, if you can unmute yourself, make sure we have audio.
1, 2, 1, 2. Can you hear me?
We got you.
Yes.
You're very faint. If you can maybe approach the mic a little closer.
Hey, folks, this is Matt Farley. Is that better?
Got you. Okay, the floor is yours.
Okay.
3 minutes.
So you're acting like the numbers going down has anything to do with the mask mandate. I mean, you go to 9 Elm for dinner, you put a mask on as you walk in. Then it's safe to take the mask off and sit there for 2 hours and have a meal. But then when you get up and leave, oh, put the mask on because it's suddenly not safe anymore in this tiny little restaurant. Does anyone actually believe that is preventing any kind of transmission? It's a superstition. It's 100% of a superstition that you're forcing upon us. And the fact that you're holding it over our heads and saying, "Ooh, we'll wait and see. Maybe we'll re-implement it." Enough already. Enough. It is very harmful to us to be forced to wear a mask everywhere we go. It's harmful for us to take part in a superstition. I mean, what is the science behind putting a mask when you walk through the door of Nine Elm and then taking it off 2 feet to the right? Is there a scientific basis for that rule? Okay, clearly there isn't. I mean, Judith's wearing a mask in this meeting, and then she takes it off to talk to us, and then she puts it back on. I don't understand. It doesn't make any sense. The masks. Anyone else feel miserable when you go to the market and you're surrounded by people in masks? Anyone else just feel sad and anxious? You can't hear people. You can't see people's facial expressions. It's miserable. You're hurting us with this mandate because it makes us sad, and you're making us partake in nonsense, absolute nonsense. Meanwhile, in Middleton, are the numbers through the roof? Are people dying in the streets of Middleton where you're allowed to get a haircut
Got
without
less than a
covering your
minute,
face
Matt.
with a piece of cloth? Are people dying in Middleton? I'm only shouting because you said my microphone was quiet, by the way. I'm sorry. But in Middleton, you can go get a sandwich without covering your face with a cloth. And people are alive in Middleton. So quit acting like those numbers had anything to do with your mask mandate, and quit acting like the fact that we are finally speaking out against it has nothing to do with your decision today. And it is just despicable that on December 23rd, right before Christmas, you all got together under the cover of darkness and said, let's ruin Christmas for everybody. Let's make sure no one smiles at each other and no one shares a conversation without first putting this on.
Mr.
Take
Farley,
it off
that's your
take
3
it
minutes.
off the table. Take it off the table forever.
Thank you. Next up is KO. I apologize. We have.
Can you guys hear me?
Gotcha.
All right,
Floor
thanks.
is yours
Appreciate
for
that.
3 minutes.
Well, yeah, first I want to thank the board for making the right decision tonight and swiftly ending this mandate as everyone else is dropping this mandate as quickly to run and cover from the negative repercussions of how frustrated we all are at what you guys think you're doing for our benefit. We don't need you to do things for our benefit. You want to give advice, take your time, and you better research deeply before you go to a step to offer my child to put a mask on his face before he goes anywhere, before I put a mask on my face before anywhere. All right. Has anyone here on the board done any of the findings into Robert Kennedy Jr.'s book about Anthony Fauci's history?
Robert Kennedy is discredited by every reliable public health person known, so don't use him as reference.
I asked the question. I just asked the question. If anybody knows what he writes about in his book that just came out about Anthony Fauci, has anyone taken the time to look
No,
at the
because
claims?
he's discredited. There's nothing to read about him.
That scares me that you have an absolute, that you will not even look at another side before making a decision.
No, I've looked at the other side. Well,
again, I only have 3 minutes. I'd like to say what I'd like to say, but thank you for engaging. What I'm saying is the vaccine that is out, like you just said, is 1 year out. You don't know the long-term effects. And then you also said you also don't know the long-term effects of COVID. So how can you jump to one side or the other when one involves injecting yourself with something that has not been proven? How could you make a decision and tell me that I need to we need to make our medical decisions based off of what you guys tell us to do?
I think as a matter of administration of the meeting, there's been no conversation among this Board of Health regarding a vaccine mandate.
Of course.
This was not on the agenda for discussion.
Okay, so I'll mix that just to say that, like everyone is saying, the discussion of bringing up vaccination rates and then saying the word improvement, you should mean saying increasing. You've increased the number of vaccinations. To say it's an improvement is that's your position. That's your opinion. And it
Medical
does not,
people
it's
say.
not law, it's not facts, it's your opinion. Because what if these injections, like Mark Smith and many others that you're not, clearly you guys aren't listening to or won't even consider, are raising major red flags, including Robert Malone, who was instrumental in this technology. So do some research before you just take what is given to you as the truth and then decide to tell us that we need to believe in the same religion of science that you guys are now forming. That's all I have to say. I'm a business owner. I never support any mandate of any kind. Masks are always optional, and they're welcome in my business at any time if someone decides that that's the best choice for them and their family. But don't ever to think that you have the right to tell me what's best for me and my family. Okay, but thank you for your advice as professionals. I appreciate it. And that's all.
Thank you. Next up is Nicole Hanlon. I'm gonna enable the mic. Ms. Hanlon, if you can just give us an audio check.
Hi, can you hear me?
Gotcha.
Yes, we can.
Floor is yours, 3 minutes.
Okay, so I wasn't actually going to speak because I was pleased with the vote and I appreciate the vote. But I did, and it was just kind of touched upon by KO. I did have just a concern. I was going to ask Dr. McLaughlin, and if it can't be addressed tonight because vaccine is not on the agenda, that is fine. But I was very concerned about the statement that he just made about the long-term effects of the vaccine being unknown, but the long-term effect, and I was taking notes and writing down verbatim what he said, but the long-term effects of COVID are much worse. And COVID is a coronavirus, which has been around for years. And I'm just wondering how the statement makes zero sense to me.
Well, 800,000 people haven't died from the vaccine, but 800,000 people have died from coronavirus. That makes it worse.
Not necessarily just from coronavirus, there's other.
800,000 people died from coronavirus.
So that was why I spoke up, because you just clearly are so one-sided and it's very concerning. So I just wanted to put it out there in the public forum for other people's awareness as well, that the statements that you spew are just personal bias in many cases. And I just don't think it's appropriate. So thank you. I just wanted to make that statement.
Thank you. Next up is Jen Cummings. Ms. Cummings, are you able to give us an audio check?
Can you hear me?
We can hear you.
Yes, we can.
The floor is yours.
Thank you. So I also wanted to thank Dee for encouraging the chairman to accept public comment last week. As the chairman said, he heard good points that he hadn't considered before. That's why it's vital to have these public comments and debates, because you hear things from other people that you wouldn't normally hear. Secondly, I just wanted to state about what I just saw happen. As a chairman, you really shouldn't be speaking over your constituents. You should hear their statements fully before you respond. So going forward, you are asking us to respect the public forum. We ask that you respect us the same way. So talking about masking, I do appreciate the board making the right decision tonight. But going forward, we are not saying that nobody can wear a mask. If they choose to wear a mask, they can do so. One-way masking works. I think back to pre-COVID days and days that I was in the hospital myself working. And we made recommendations for severely immunocompromised people. Maybe they were going through chemo or had a recent organ transplant. And one of the things that was always recommended for them to wear in public to protect themselves, and I'm going to repeat, to protect themselves from public exposures to bacteria, viruses, etc., was a mask. Again, protect themselves. Experts are now coming out saying one-way masking works. Nurses and medical personnel who enter hospital rooms of sick patients mask, but the patient is not required to do so. So I ask the board, what is your position on one-way masking where experts and people use it on a consistent basis? Are you saying that masks don't work and that we shouldn't trust the experts? Or are you going to say that one-way masking does work, and if people choose to do so, they should do so with a mask that provides optimal protection for themselves? And last, I just wanted to say that we have been told over and over for the last 2 years to follow the science and follow the experts. So I'm reminding you, the board members, to please follow the science and follow the experts. Thank you.
Thank you.
Thank you. I've been tracking the, who's had their hand raised, for the board to decide. You have 3 hands up. All of them have provided prior comment, so I'm not sure what you wish to do.
Unless they have a positive comment, they can do it if they want, but I think we've got to be a little circumspect. And I think when people start shouting, and basically, just letting off steam is not what this is intended for. So if they have something constructive to say, that's fine. But I just don't want to listen to harangues. So if they want to do that way, anybody else want to jump in for that? D?
Yeah, if they want to speak, that's fine.
I'd like to have something constructive. I don't want to just, be told how terrible we are.
I do see a hand is raised from someone who has not spoken. Couple other ones that have come up, but Sean has not spoken yet. But you guys, I guess would ask the board, just you tell me what you want to do and I'll go from there. But if you want to hear from Sean, I will enable the microphone.
Yep.
Sean, if you can give us an audio, if you unmute.
Hello.
Gotcha.
So there's a lot I want to say, but I'll just keep this very quick. The whole vaccine thing, how the doctor is so pro-vaccine regarding children. Sir, you are reckless. You're dangerous.
All right.
I'm calling on you to resign.
I'm sorry.
Cut that off.
I'm sorry.
Cut that
I'm calling on you.
The
Just cut it
gentleman
off.
is out of order. That's the personal attack.
So no personal attacks. You can disagree with what I say medically, but I'm the medical person and I have my opinions, and that's what people come to me for. You may not agree with it, but you're not going to convince me otherwise, because I've done the research. And I've done research, which does not include reading Robert F. Kennedy's book, which is not medical research at all. Okay. So we got somebody else that's...
We do have another first timer here, in Nicole Howland. Ms. Howland, if you can unmute and give us an audio check.
Can you hear me?
We can hear you, but you're very faint.
Oh, sorry.
Can you speak up a little bit?
Can you hear me now?
It's audible, but it's low.
Oh,
Hello?
Perfect.
Okay, so I understand that you as a doctor do not want to get attacked, but you have to listen to what people have to say. This isn't fair to any of us. We have been told that 2 weeks to slow the spread. It's been 2 years. It is not okay for the kids to be dealing with this. It's not okay for the adults to be dealing with this. Corona's going to be here forever. We need to learn to live with it and just get over it. Like, there's nothing else we can do. My mother's going through chemo. If she wants to wear 5 masks, then she can. But I don't have to. I'm perfectly healthy. It is for people who are sick to wear masks, not for somebody who's healthy and doesn't need to worry about this. And Dr. Fauci, you shouldn't trust him. He's a piece of shit.
All right, cut her off. That's it. All right, and I'm just going to bring this to an end because I'm just tired of this invective. People cursing at other people that they don't even know is just out of line completely. So if you have something constructive to say, I'll be glad to hear it, but I'm not just going to be harangued by somebody who has an axe to grind. You are not going to tell us not to use vaccines. It's public health policy to use them. It's good medicine to use them. If somebody in there is a healthcare professional, they know that there are standards of medicine that we use. Not everybody agrees 100% with them, but they are the standards of medicine we have to apply. And any physician who did not promote vaccines that were safe and effective would have his license revoked, justifiably. So the fact that you think they're poison is fine, that's your opinion, but it's not necessarily fact. So let's not confuse the facts. As to Dr. Fauci, in February 2020, when this pandemic was just getting started, he said, as most medical people thought, that masks were not going to be very effective. Over the course of the next few months, we learned, as we do in science, that they were more effective. And they're much more effective at having people that are carrying the virus and don't know it, giving it to people who don't know that the person is carrying it. So the reason you wear the mask is not so much for your own protection as protecting your friends and your fellow citizens. If you want to protect yourself quite a bit, but the regular surgical masks and cloth masks are mainly for the protection of others, to keep your droplets from spewing in the air and infecting other people. That's probably 95% of the reason why we wear them. It's good citizenship. I refuse to believe that there's major mental health issues coming up with this. There are inconveniences, and you're all going to go off on that, but that's my 2 cents worth. Okay. I see everybody's raising their hand now, so we must have some. Judith, did you want to say something? Oh, okay.
If I could, Mr. Chairman, I think we're heading toward the end there. I just wanted to remind people that the mask mandates have now been lifted, but people should still free. And I think one of the residents mentioned that. I think it was Mrs. Cummings, if I believe. People should still free to wear their mask if they need to. So I will still continue to encourage people who are immunocompromised or people who are in setting where they don't feel comfortable or if people, so they should still continue to wear their masks. We are not saying that masks are prohibited. We are just saying that they are optional. So if people want to wear it as they go about their way, especially indoor, they're more than welcome to do so. And I also want to really thank the businesses in town who have been really, you know, we've been going back and forth with this, all of us struggling with this pandemic, and they've been there, enforcing it, trying their best to make sure that we stay healthy. And I mean, we we will say, yeah, things didn't go down because of the mask, but one thing we can all agree on is it didn't get worse because of the mask. So I really want to thank all those businesses for really doing whatever they could to enforce these requirements.
All right, so we have any newcomers in here?
Doesn't appear so.
So these are all repeats?
I'm just looking at my list. I think so. Just looking at the list. Well, we do have a few first timers here.
Okay.
And I apologize, I'm a little bit out of order, but I know this one hasn't gone. TC, I'm going to enable the microphone. TC, can we get an unmute and an audio check?
Hi there, can you hear me?
Gotcha.
Thank you.
3
Thank
minutes.
you for having this meeting. I want to keep it really positive because I know there's a lot of hurt feelings here. I just want to thank everyone. Thank everyone for recognizing that it's totally appropriate to recommend administering a medical intervention on a one-size-fits-all basis. To recognize that vaccines are safe and effective for absolutely everybody without having any prior access to their medical records. For thanking everyone to recognize that there are absolutely no adverse reactions to vaccines and that our lack of long-term studies on these vaccines are of no harm whatsoever to anybody at all. I just want to thank you for following the science. I also want to thank you for recognizing that people and children perfectly doff and don their masks, that they do not ever touch their masks with bacteria-ridden hands. I want to thank you all for recognizing that and always following the science.
Thank you. I do see Sandy has not spoken. Sandy, if you can unmute.
Hi, Erin, can you hear me?
Gotcha.
Yes, we can hear you.
3 minutes.
Okay, great. I won't be on for very long, but I just wanted to thank the board for dropping the mandate. I think it was very important to do so. I just had a couple of questions. I know we didn't have an agenda about certain services and such. I just had questions for like restaurants, hairdressers, like hair establishments. Are they going to be allowed, business owners, are they going to be allowed to choose if their employees can be masked or not? That's what I just wanted to find out. Is it okay for businesses to allow that as well? Thank you.
Am I right to say they can always allow, I mean, they can allow it or they can require it within their business? That's up to them.
Correct.
I just wanted to make sure, that's all. I was just
Yeah.
curious if they were also going to have that option as well.
Yep.
Okay, thank you for your time.
Thank you. The other hand up is Matt Hannis as a first timer. Can we get an audio check, Matt?
Hello?
We have you. The floor is yours for 3 minutes.
Excellent. Could anybody on the board explain to me what or by what mechanism the science has changed on masks? Because prior to 2020, it was pretty much universally accepted that masks did not prevent the spread of respiratory viruses. And then from 2020 to 2022, all of a sudden they did again. And now we have the pre-2020 science being resurrected as one-way masking. So I've tried to look and see what may have changed about masks and, you know, the propagation of respiratory viruses that would cause the science to change.
If I can answer that from a medical perspective, prior to 2020, masks were mainly used on people who had infectious disease like tuberculosis to prevent them from spreading it to others. And as an added security, oftentimes the visitors with those people would also wear masks on the small increased protection that they got. But the main thrust was the patients themselves not spewing out the germs. We had such a contagious virus that we were gasping for any possible, you know, way of reducing the risk of spread. And even a small change makes a big difference. Early on, somebody showed that some study had showed that the mask reduced spread by 11%, which didn't sound like very much, except that if that was carried to its extreme, would mean there would be 100,000 people that wouldn't have died of COVID, which is about 11%. So small things make a big difference when you're talking about large numbers. But I agree with you that the one-way masking is only partially protective. Unless you're using an N95 mask, you're not going to protect yourself tremendously. You're going to protect other people in case you're an asymptomatic carrier. Do you have anything to add to that, Dee?
Yeah, I'll just say that we also need to realize that science, as static as it may seem, it is not. We were dealing with a whole new virus. I remember the days where I had to get my mango from the store and try to find some Clorox to wash it with and to wipe every surface because we thought at the time that is how it was being spread. You know, people will say, bring your grocery out, leave it at the doorstep for 3 days before you can touch it, so that all the COVID can die out there before you bring it inside the house. So, and I'm not saying you play Monday night quarterback, but as this is something that changed over time. It was very dynamic. It was fast moving, and the common denominator was that people were dying. So we were trying to find every single way we can to save lives. And masking happened to be stopping the big particles, the big droplets, where that virus lives from going out, especially if you're speaking or sneezing or shouting or singing. Or so it, it's hard for me to sit here and say this is the one thing that's been in effect for 20 years. How did it change? We were trying to find every single mitigation parameters that we can use and put in place to be able to not eliminate the disease or eliminate the spread, but at a minimum, decrease it to give time to the hospitals to be able to get cases at a manageable level.
Okay, I mean, and I don't mean to put words in your mouth, but we're saying that we basically just kind of threw stuff up against the wall and hoped that it helped. I mean, we have 2 years worth of data that I think we can use on a go forward basis, right, to help inform us about whether or not masks work. I mean, again, I'll say what I said at the last Board of Health meeting. I'm not saying don't wear a mask. I'm not saying wear a mask. I'm saying it should be up to the individual. And I think if, certainly the board has an advisory role, but when you venture into the area of mandate, I think as a matter of public trust, you owe it to the public to, to make your case that yes, indeed, it does need to be mandated. And this is the data that we're using, and, kind of put it out there. I know I'm probably over time, and obviously your response is cut into that, but I would just like to point out today that if I go to mass.gov and I look at the hospitalizations of people with or people vaccinated and unvaccinated, it's about 50-50. So, I don't know if that constitutes an overwhelming majority, but I think we just want to be careful about the things that we say without having actual facts to back it up.
Well, the other thing, just to put a point on that statistic, is that remember that you're getting everybody in there with a positive test, but over half of them for some time now have been people admitted to the hospital for other reasons and who test positive while they're there. But for people that are there with respiratory illness, with COVID illness itself, it's in the 90 percentages that those people are unvaccinated.
So could you apply that same theory to deaths from COVID as well?
Well, actually, it goes the other way. There's probably maybe as much as double the number of deaths. People, they don't, for instance, test people who are dead. And if you died from a heart attack, which could be in fact triggered by COVID, you wouldn't necessarily be diagnosed as COVID. So we may be undercounting the deaths from COVID because there are people that weren't diagnosed with it, but died as a result of it. And you also have to take into account the people that didn't ever get COVID, but couldn't get help for something like heart attacks or strokes because the hospitals were so jammed with people with COVID. Those people died from COVID too, just not directly. So you're not going to get any relief on the statistics for deaths because if anything, it's undercounted.
Well, I mean, we can agree to disagree there, right? I think if you look at the CDC statements, right, the majority of people that died with it have had 3, 4, 5, 6 comorbidities, right? So without an in-depth review of death certificates, you don't know for sure, right? So I mean, certainly we appreciate the magnitude of it, right? But to say this is absolute fact, I think is just something that I would be cautious about. Thank you for your time.
And not to drag this on any further, I mean, some of these meta-analysis and data will definitely come up over time, and we will go into we can't sit here in a 1-hour meeting and dissect every study that is out there. But
We lost you, D.
Must be cold in the 6th precinct. Well, just to fill in what Dee was saying, I mean, people keep quoting studies, and you can handpick a study which will show you virtually anything you want. In medicine, none of us have the time to read every single study about what we're talking about. We rely on experts. We rely on the CDC. We rely on the American Academy of Pediatrics to summarize those and to come up with a consensus.
Am I on now?
Oh, yeah. Yes, you are. Go ahead.
Okay, I'm sorry. Yeah, no, I was saying that we can't sit here. I mean, you can't sit here and quote every study that have ever existed or that are out there. But even the one that has been heavily quoted, when I look at the whole study, I mean, it's not quite what the highlight, just the one word says. There's a lot of inclusion and exclusion criteria that you have to take into account. That could be flawed. But the one thing that we do know is that the physical separation of those big particles, if you wear it one way, you get protection. If you wear it both ways, you get a better protection. It's just, it has not changed.
And as I was saying, Dee, while you were off, that none of us is going to be able to read every single study that's available on this, and we have to take consensus views from experts. I mean, I take my cues from the American Academy of Pediatrics and the CDC. Are they ever wrong? Sure. Sometimes they have change in opinion, and that's the nature of science. Science changes as you learn more information, and what we thought we knew in 2020, we know we didn't know, and now we know something different. That's not a mistake; it's just knowledge. And the problem is people are holding us to the standards of 2020. If you want to go far enough back, you'd all be getting treated with leeches and bleeding and things like that because medicine wouldn't have advanced. But it advanced even in the last couple of years to the point where we now know things about this virus we just didn't know at the beginning. So we have anybody else, Aaron?
Only second timers.
Well, Aaron, if you can keep watch, like I said, I mean, I'm willing to listen to any reasonable talk, but I just don't want to be harangued with people just yelling at me and telling me I'm wrong and stupid. And I mean, the things people forget is that we're basically volunteers. We're unpaid. We do the best we can. We don't always agree with everything that the public thinks. And our job as leaders for the Board of Health is sometimes to take a path that isn't popular, and sometimes one that the majority of people don't agree with. But that's what leaders do. They don't just follow the crowd. So I have to tell people that when I suggest something, it's my best knowledge, and they don't have to agree with it. But you know, that's the position that we're in. We're supposed to be the leaders of this and taking action that's going to protect the public health. So if you want to let them go, just keep a watch on it so we don't get nasty.
I mean, again, at this point, you only have repeat. Do you want to go through the repeats?
Sure, but with that caveat, you know.
Okay. I'm just going to go in the order the hands are raised, which puts Mr. Farley up next. Mr. Farley, if you can get an audio check.
Hey, can you hear me? Am I still quiet or what?
You're good.
Okay. I'll try to be quick. And I know everyone means well, and nobody wants to hurt people. But just know that all of us are sitting through this, I'm sure we all agree, incredibly boring meeting because we feel so passionately that the masks are harmful. And I know you say you refuse to accept that it affects mental health, but I totally accept that it. And Dr. Tom, you make a lot of facial gestures when we speak that really makes you think that makes it seem like you have no respect for any of us. But it does. It hurts. It hurts me to be forced to put on a mask when I walk into Brothers Restaurant. Then I get my food. Then I sit in the crowded cafeteria and everyone's mask-free eating. And we're all obeying your mandate. How does that make sense, Dr. Tom?
I don't even know what question you're asking. I mean, you can't eat through a mask.
Okay, then.
So when you're up and around walking through the restaurant and you're passing people by, that's when you're most likely to spread the virus if you have it.
And that this scientifically makes sense to you that the person who's 3 feet away from me on another table and we're safe to not wear masks because we're sitting at a table?
All right, so we're not going anywhere with this discussion. If you have something constructive to add, that's fine. But I'm
okay. You clearly have no answer for this question, so shame on you. No.
Next.
KO, I'm not sure.
Yeah, no, I'm here. Thank you guys. I appreciate you guys taking the time to let us, further a quick discussion. I'm not. No one's trying to harangue anybody. I don't think that's anyone's intent coming here, sir. I apologize if you feel that way. But kind of second what he's saying, we can see you. You can't see me. So every time someone says something you don't agree with, you see you scratching your head, looking away, rolling your eyes, scoffing, and I don't take that as respect. And I do nothing but respect that you guys give up your time. You're not being paid for this, and your intentions are well. We just disagree with many things, it sounds like. But I think we can all agree that this town does not want a mandate. I haven't heard a single person here to support putting a face mask man back in place, no matter under any circumstances. So I'd like you all right now to vote on whether you will just end the mask mandate debate once and for all, put it to rest, and put it behind us, and let us all come together as a community and move forward with actual measures that help us.
I'm not going to promise we won't. How does the rest of the board feel? I mean,
the gentleman is asking for a vote right now. That's not even feasible. It wasn't part of the agenda, so we can't take such a vote. So procedurally, that's not even something, unfortunately, that we can consider at this time. So is there somebody else?
Understood. No, understood that. But Dr. McLaughlin, I'm gonna engage you separately in an email. I'd like to see some of these facts that you have that completely just make you shun anything that anyone says that goes against it. So I'd like to reach out peacefully and respectfully. I hope you're open to that. Thank you very much.
Next up is Ms. Skinner. Should be able to unmute and.
Hi, you hear me?
Gotcha. Yep, gotcha. Go.
Thank you so much for letting me speak again. And a couple other people sort of raised what I wanted to say that's really on my mind tonight. I am a member of a board locally in Danvers of a small 501c3. I know it's hard to hear from people that both agree and disagree, and I thank you guys for your service to the town. I'm a little alarmed to hear, somebody saying, well, I don't want to hear from people that are just going to tell me that I'm wrong. It's part of the job, unfortunately. I understand it's hard, but most people here, the vast majority of people I've heard this evening have shared interesting information. Certainly, they're tax-paying citizens, and most people have been respectful and expressed thankfulness to you guys. And I'm really disappointed as a citizen to see that some people's faces, I know you can't see us, as someone else said, but we can see your faces, and there are somewhere, if I were voting and responsible for filling these roles, which I know that's not how this works, but like, this just, we can expect more, I think. Seeing people rolling their eyes and, sighing heavily and tossing.
Okay. Let me just interject here, because this comes down to.
If I could finish, please.
Okay, all right. But would you stay on when you're done so I can talk a little bit?
I can tell that you're frustrated.
No, that's not what it is. I just want to say something when you're done. That's all.
Was that you said earlier that you refused to believe that the mask mandate was anything more than a minor inconvenience, or that there was a mental health crisis. But then a few minutes later, you mentioned that one of the resources you turn to, as because it is hard, I totally understand, to get through all the information out there. I'm overwhelmed. I think it contributes to anxiety to have so much information for myself personally. I get that. But you mentioned that you listened to the AAP. And that's one organization you turn to kind of crystallize and some of this information for you. I just wanted to make sure you're aware, because I agree we should listen to them. They said back in October that the state of mental health in our country is, quote, a national emergency.
Right, absolutely, but it's not because of masks.
To believe that, and I just wanted to, well, you could show us data that masks don't play a role, maybe, but most people are telling you, as citizens who are parents of children in the town and people sharing our own experiences, our children's experiences, and we're saying to you guys as members of the board that we think that they are. And so I just would love to see more respect to us. And I wanted to also say, you mentioned that, people used to believe in leeches and this and that and the other, but you also, I can tell, feel very confident today we're getting it all right. For me personally, I've been homeschooling my kids during the pandemic. Every time we read about what people used to think in history, I'm humbled. I'm deeply humbled. And I sit here thinking, I wonder what today we think is so definitely true that in 10 years, 20 years, 5 minutes, we will realize we were wrong, because we're human. We're often wrong. It was not long ago we thought smoking was totally fine, including for pregnant women. It was not long ago we thought autism was caused by cold mothers who weren't warm and loving enough with their children. So we may not have it all right. And I think if we can all have humility and try to be respectful for one another, it will go a long way. I know we're in a really challenging time, and thank you for listening.
Okay, my statement was that I was going to make that we do the best with the information we have at the time, but that projecting ahead and saying that because we don't know anything, we shouldn't do anything is wrong. The second thing is when I expressed my frustration with the harangues, what I meant is that one of the great problems in our society right now, as I see it, is that all this false information is being fed out and accepted as fact. There are certain things that in science we accept as facts. Maybe that will change. We're willing to change, but as of right now, this is the best information we have. The best information we have about vaccines and masking is what we've been presenting. Not everybody agrees with every single item of it. We do the best we can. The Academy has acknowledged, as I do, that there is a mental health crisis in this country in children. It's not because they have to wear masks. It's because of the social isolation they've had. That's another issue altogether. But the mask is not what caused children to have mental health issues. As a matter of fact, on the American Academy website, under healthychildren.org, they say very clearly that there is no physical harm to children wearing masks, including children with respiratory problems, speech problems, etc. They go right through the list. And they clearly state that the children do not suffer emotionally from wearing a mask. So read it on the website. That's what it says. Okay.
I'm gonna jump down to a first timer, Jane. I apologize, I don't have a last name. Jane, if we can get you to unmute and get an audio check.
Hi, can you hear me?
We got you.
Yes, we can.
3 minutes.
So I guess I jumped in late. I heard most of what I needed to hear, which was wonderful. Glad the mask mandate's being dropped. My question is now, we keep hearing from the board, mostly Dr. McLaughlin, that you're doing this for free, you're volunteering your time, you're weeding through information, right? What's driving you to be on the board? If you're gonna roll, and I'm looking at you right now, you're rolling your eyes at me, you're looking down, you don't want to be questioned anymore. But if you were the CEO of a company and your numbers were tanking, who else would they ask? Would they ask the janitor? You're the one responsible at this point. So what's driving you to sit in this seat if it doesn't seem like something you really want to do?
I do want to do it. I just don't like to be
Challenged?
attacked personally. No,
You don't like to be challenged.
I don't like to be attacked personally is what I don't like.
Okay, so then again, I ask you, as someone sitting on a board, why are you doing it? Because isn't this part of the job? If you again, if you
It's the benefit of the health of Danvers.
I think, again, and I don't want to cut anybody off, but trying to moderate. I mean, I think the agenda tonight was, we wanted public comment. The board was looking for public comments regarding the mask mandate. I'm going to say generally this conversation is sliding into something very different from that, which is fine. The board's totally willing to do that. But I just wanted, again, the guideposts for the evening were a discussion around the mask mandate. And I think it feels like we're sliding into a different conversation. But again, I don't want to cut anybody off, lose anybody's time. The board can do with it as they will. But
All right, is there anybody who's only spoken once? I see people on here who are looking for the third.
I have one more first timer in Danielle. 1 second. Danielle, I apologize, I don't have a last name. If you can unmute and we can get an audio.
Hello.
Gotcha. 3 minutes.
Hello. I'm so speechless in the fact that a pediatrician would actually stand by his word and say 100% that masks aren't affecting children mentally. That is so scary to me that you actually even have a practice and people pay.
Aaron, Miss Jane, Miss Daniel, if I can interject, I'm sorry.
Sorry. I mean, you have.
I understand. I understand, Mrs. I think it was Mrs. Daniel. I understand. But as Aaron indicated, the board was meeting tonight to discuss masking and get the latest data as far as the COVID is concerned. I don't think that is serving any of our interests or any of us to be attacking to be attacked personally. If you disagree with the fact that the mandate was put in place, I respect that. If you disagree with the fact that it has been lifted, or if you agree, I respect that as well. But when we making general statements and into like this which seem a little extreme to me, I don't think I think that's I I think that is not okay. So we really welcome comments, and we're here for you. We're here to do the best we can, as Dr. McLaughlin said. But I think it's important that we stay away from personal attacks on an individual. If we could do that, I think it would be a service not only for us as residents, but for us mentally as well. So please, I'm sorry that I had to cut you off, but I would just urge anyone who is speaking to stick to the issues on the agenda and leave away the personal attacks.
I do see another couple of first timers up. Should I proceed?
Sure.
Sure.
I'm just going in the order that they're listed. Ashley, I don't have a last name. I apologize. If we can unmute and get an audio check.
Hi, can you hear me?
Gotcha.
Yes, we can.
Hi. I just want to make one comment. I think everybody's just really frustrated. I personally have emailed privately many people in this town with concerns about certain individuals, and nobody ever responds. Nothing's ever done about it, and that's just really frustrating. So people are sort of at a boiling point with this individual. I'm not going to attack him on here, but I've raised personal concerns, not in a public
All
forum.
right, can we cut? All right, I know who she's talking about. Can we just end this right now?
No, excuse me.
Can we end this, please, Aaron? This is about the mask mandate, period. Hello?
Yep, we disabled.
I mean, this is one who has attacked me personally, and, you know, I'm just tired of it, that's all.
The next first timer is a Danielle Hawk. I'm going to open the microphone. If you can unmute,
Hi.
you have your audio. Yep, go for it.
Hi. Thank you. I know this is volunteer and I know everybody has the best intentions, and I think this is just been a long 2 years and we're all emotionally charged. I would just ask, I guess, Judith a question on, we get a lot of stats on positive cases and things like that, but I don't see cases to the point about masks, like where everyone's saying they aren't detrimental. Like, I would like more data on the holistic COVID impact that this is having on everyone's life. I believe if you collected data, you would see that maybe a lot of parents and children are struggling. And to that point, I know this isn't about vaccines, but there's VAERS and there's many cases of, situations, and it's everyone's choice to roll the dice and how much you want to gamble with that. So to feel like your children will be excluded from something in town, because you don't, I'm sorry, Dr. McAuliffe.
No, I was stretching my neck, I'm sorry, I wasn't rolling, honestly.
Yeah, and I know you've given your life to medicine and to children, and I respect that. I really do. I just think it's, to me, and maybe I'm too simplistic, my children are healthy. If they've had COVID, they recovered fine, they were asymptomatic, I believe. So I don't want to roll the dice. It's like going to Encore. Somebody might be comfortable spending $5,000 at the roulette table, and I'll spend 10. I don't like the fact that one size does fit all, or that our kids could be excluded in society holistically or by Danvers, Desi, Danvers, whatever it is. That's concerning to me. And I mean, to the point, I look at real estate in other states. So I
think she muted
it's a real
herself.
concern of parents. I thank you for your time. I just, some of us just aren't where you are at, and everybody gets comfortable with different situations. And the fact that children could be excluded anywhere in Massachusetts in schools and sports and activities is so disheartening to me. It's just, I wish everyone could just find a middle ground and work together to get past this, because nobody's happy with this situation. But to think that you're right or I'm right, nobody's right. Nobody knows yet. Yes, there are some facts, but it is still so unknown. Let us take the time to breathe it in. Like, you know, I just remember back in the day when, I forget the medicine they gave mothers in the 60s, and there were tons of miscarriages. I'm worried about giving something to, and I got all my kids vaccinated with all their wellness shots. I believe in it.
Right up against your 3 minutes. Sorry.
Okay. Thank you. I'm sad that everybody is fighting, and I believe we all have the best intentions for our town, our friends, our family.
We know you do. We know you do. And nobody's talking about using vaccination as an exclusion thing. I understand the struggle people go
I
through.
can't go to Boston right now. I can't go to Boston. What do you mean?
Really?
I can't take my kids to a Red Sox game. They're heartbroken.
Well, that's local. I mean, that's not, that we're talking about Danvers though. That's a local thing. I can honestly tell you, I don't envision that. So
Yeah, and I don't, I mean, we can't speak of other communities or other nations or everywhere else. But as far as Danvers, I don't think that's part of the discussion to exclude
Understood.
anyone
I
for
probably I
any
went.
of those reasons. And I definitely, as a parent myself of young kids, I do share your concerns. I don't want anyone to be out there and think like we are these cold-hearted people who don't care. That is not the case. The
No.
decision that you're struggling with for your daughter or son, I did struggle with the same decisions for mine. At the end, I did get all my kids vaccinated after consulting with their pediatrician, and we actually went back and forth. As a healthcare professional that was actually out there working with COVID patients as well, I did I wasn't sure I wanted to get it either. So these concerns and questions are legitimate. And and anyone who thinks that they're alone into making those difficult decisions, you breaking news, you do have company. We all in the same boat. We all struggling with the same thing. And that's why I did rely on my kids' pediatricians and on my own PCP. I had COVID back in April of 2020 and thought I was immune. And when I went for my physical, my doctor and I went back and forth, and he said, you got to get a vaccine. And I follow his guidance after I did some of my own research. So you are not alone, and these concerns are legitimate. I'm just urging all of us to know that we all have we all have good intentions. We all in this town, we all want our kids to go play basketball and soccer and swim together, and we just all trying the best we can with whatever information we have at a specific point of time to make that decision. If we all agree on that, I think we will further this debate and help each other.
No,
I'm not running
I
for
just,
anything.
I just think some people are comfortable right away. You know, some people are ready to dive in the deep end, and I just wish that it was a little bit. It takes others a little more to trust and get to where maybe you are now. And I do research, I do read. I think everybody does. It's just, I just think I'm happy for people that are comfortable to do it for their children. I just as I'm not there yet. I want to be there. I do. You know, it feels terrible when you see the things that say you're hurting your neighbor. I mean, that brings me to tears because that is not, I mean, we shovel our elderly neighbor out. My kids go over. That is 100%. And I know that's not Danvers, but there is some nastiness that does go on, you know, locally in Danvers, nationally. It's just a shame. I do appreciate, I know you guys are all working hard. We'll get there. I think we
Well,
just all are at our own pace to some extent. So
just remember that all of us are working for you and we want to do the best thing for you. And I mean, I don't want to pretend like I'm your parent because I'm not, but sometimes in a relationship where you're supervising something, you have to do unpopular things. And, you know, this mask mandate was clearly unpopular, but we all felt it was the right thing to do and we did it. And that's where leadership comes in. You sometimes have to take people in a direction they don't want to go. We did the best we could with the information we had.
no, and leaders also listen, and you have, and you're changing, and we can see what happens, right? Let's see what happens. But so that's all. I know we're all in a bad spot.
Yes, we.
So
We
I
are in the
just
same boat, and it's a journey, and
Yeah.
your level of comfort will come at some point, and nobody should be ashamed for not being there yet or for being where they are. I think that is a normal course of this. There's a lot of things changing, and people will have different level of comfort. I just think that we should still know that we have all the best intention and not attack each other. That's when we lose it. Or when we
understood, and I
start
think
using
Doctor.
information that is not accurate. That is when we have a problem. If we have a same set of information, we may disagree on the interpretation, but and make the final decisions at a later time or a sooner time. That really depends. But just know that we share that sentiment, and there's a lot of people in this town who share the same sentiment. It's hard. It's
Yes.
not easy.
Yes, thank you. And you know, Doctor, I can see you're passionate, and I apologize if you feel attacked. I'll just I think your passion comes over on the video, and your expertise, and people take it maybe negatively, and you know, it is a little like off-putting, but I've been in many meetings in corporate America where body language, so I
You're right.
get that you have the best interest, but I just think it can upset some people, and that causes a little
And
fray.
just so you'll understand too, that I have been preparing my patients for this vaccine now for a year and a half. And I'm busting discussions with families about getting it or not getting it. And I've tried to convince them that it's the best thing for their children because it generally is. And I've tried to answer their questions. And it gets very discouraging when you use a certain set of facts to discuss things, and then you're told that those facts aren't correct and that you're a terrible person.
Understood.
That's
I can
that's
only
part of it.
imagine.
That's part of the body language comes across that way. I'm sorry if you experienced it. It wasn't meant.
No, and I can only imagine that I can only imagine in your profession that it is frustrating for you, so I acknowledge that, but other people
Yep.
feel passionately. And anyway, thank you. I've had way more time, but thank you.
Thank you. Pleasure of the board. We do have a few other first timers up.
Sure.
Not sure how. Okay. Next up is Paula Mountain. If you could unmute and we can get an audio. Doesn't look like we're gonna get that. Let me just move down the line there. Let's try Maddie Monahan. If we can
Hello?
unmute. Gotcha.
Hey, my name's Andrew. My girlfriend's name is Maddie. I just wanted to say thank you to the Board of Health for the work they're doing. And this is in their spare time, and I appreciate that. I'm 22 years old. I'm a college student, and I know that I'm a lay audience. This entire audience is not experts. You guys are the ones who are out here every day in the science, seeing this, and I believe that, I'm for whatever you guys believe is necessary. I'm not gonna lie, I am surprised that people are so angry about this. I'm appalled listening to some of these people, and some of my reactions are worse than your guys. I know I'm in the minority in this, and it's not going to be forever that we need to have masks on, and this is something that is not. It's just, I'm upset about our community having to have this discussion when this is just in the best interest of the town and the people in it. I work with kids. I go to college, and if we can keep doing these things by wearing masks, I'm for it. I know that there are some people who aren't able to wear masks, and that's okay. But I apologize for some of the things that have been said tonight, and I appreciate the work you guys have been doing. I just wanted to give you guys a little bit of love, and keep doing the great work. Thank you, guys.
Thank you. Thank you.
I'm gonna just try Paula Mountain again. Not sure if we can unmute yourself. We can get an audio. Going once, going twice. I will move on to Caitlin Monahan. I apologize if I'm not pronouncing that right. We're going to enable the microphone if you can unmute and we can get an audio check.
Hi.
Gotcha.
First of all, I want to give the Monahan love to Maddie Monahan. I know that's not your name, whoever just spoke before. I don't know why my camera won't turn on, but I full disclosure want to give that I am the chairman's daughter. I am Caitlin McLaughlin Monahan, and I say that very proudly. I am grateful and proud of what the board has done in the past to protect our citizens of Danvers, to make sure that all people of all ages are getting the protection that they need. I am very behind in the meeting. There are many, many comments I have not listened to. I was unfortunately at one of my children's who has significant special needs outside appointments, and so I couldn't join the meeting on time. So I'm not quite caught up to where I need to be. But I've listened to people chastise people who have ridiculed, who have not listened to science. And I have kept my mouth shut for as long as I can. And I just want to, again, thank the board for the decisions they have made for the greater good of our community. I'm thankful for what you have done. I think you should be proud of what you have done. I think you should be proud of the decision you have made today to
Got less than a minute, sorry.
Mask mandate, so that we are moving with the science. And I just wanted to say that I'm grateful and thankful. I know that I'm a little bit biased. I know that as the daughter of the chairman, I have in my 39 years of life watched him listen to people who have had medical concerns, medical issues. I have watched him make decisions for people who need his advice. I've watched him be so sad and upset. I have watched him do the right thing for so many people in this community that I don't think people are recognizing. So I just wanted to say thank you for everything that you have done and everything moving forward. So that's all I have to say. I have no other comment, but thank you.
Okay. There's one more hand up, first timer, Andrew. I apologize, I don't have a last name. If we can, Andrew.
Can you hear me?
Yep, we can hear you.
Okay, let me go over my bona fides if I can. In 2003, I got an OSHA 8 certification. In 2004, I got an OSHA 30 certification, as long as a hazmat license and a HazWOPR license. So I just want to address something about doing the best with the information that you have at the time. In 2005, I knew that surgical masks or cloth masks did absolutely nothing for the spread of communicable diseases. They do nothing. And I've known this for almost 20 years. How could you sit there and say that you did the best with the information that you had at the time? You got it completely wrong. And as far as the harangues, you'll get harangued when you get it completely wrong. Get it right the next time. Grow a thick skin, because this is the new normal for you. There will be harangues.
I think that's enough.
You have wronged people.
Okay, Paula Mountain has not spoken yet. First time speaker, Ms. Mountain, do we have an audio check if you unmute?
Hi, yes, can you hear me?
We got you. Thank you.
Okay. I just thank you for letting me try a couple of times. I was having difficulty, but I work in town government, and I think part of the challenge here is we all see you, but you don't see the people talking to you. So the people who are commenting and calling in, I would bet that they have their own facial expressions and rolling of the eyes and tipping of the head. So I'd like to just sort of defend you guys for that. You're on display, and that's not really fair to everyone else who's got an opinion about body language. It goes along the lines of texting, right? You can't see inflection in the texted words. So I just wanted to say thank you to all of you. I know how difficult this is. As far as the mask goes, my family had COVID back in November of 2020. Judith was wonderful to us with the information. I have been wearing my mask since the beginning. I maybe stopped for a few weeks back in the summer and then did not feel comfortable with that. I don't see the problem with wearing masks. Yeah, you can't see someone's whole face. It's a bit of a challenge. I can't see my feet when I walk. I might trip. But what is the big deal about wearing masks? I don't understand it. You can get pretty ones. You can do the disposables. I mean, for the love of God, it's just a mask. It's not like this board is mandating a vaccine. My children, I got vaccinated. I defer to my doctor. I have not been, if my husband, I tell him the second go around, you should kick the tires for the next wife, because there's been a lot of medical things with me, and I defer to my doctors for their expertise. The HPV vaccine came out for the kids. They were 12. I'd never heard of it, but the doctor said, this is what you should do. I defer to science, and science is always evolving, and it's always going to change. So to say, shame on you, back in 2005, we knew about this kind of mask. You know what? We're lay people. You guys have levels of expertise. I thank you. I just really wanted to defend you. It gets me very angry for people to sit and pontificate and be so righteous about your body language when, I guarantee if they don't like what they're hearing, they're doing the same body language expressions. My opinion on a mask, I'm fine with it. It screws up my makeup. Yeah, but who cares? If this is what it's going to take to keep my 86 and 85-year-old parents from getting
Ms.
sick.
Mountain, you're getting right up against your time.
All right, I'm all done. I just want to
Thank
say
you.
thank you.
Thank you.
Just looking at the list, I think you have one, Geraldine Masters is the only first timer.
Okay.
Okay.
I hope it's Ms. Masters. If you can unmute, we can get an audio check. The microphone is enabled, but they're not unmuting themselves. A few people have had that problem tonight where they need to log out and come back in, and that should fix it. Otherwise, I don't know what to tell you because we've enabled the microphone from this side. To the board, we can't.
Okay, so I mean, if that was the last one, I think that was the end of the agenda, right, Mr. Chairman?
Yes, I think so.
Yeah. So I just want to thank again, I thank people in the community and everyone and for the comments and everything. So
So do I hear a motion to adjourn?
I move that we adjourn.
I second.
All right, I say in favor. Dee,
Yes.
Sheila,
Yes.
so we're adjourned.